Hi all, so this is going to be a short video just talking a little bit about Section D of the Unit 5 coursework, focusing on the roles of professionals and how they work together to provide care and support. So this is for P6, P7, M5 and D4. So the first thing, just to kind of highlight what we're looking at with Section D, I'm going to get rid of the bits we're not going to do today. So I'm only going to focus on a couple of little bits of Section D. I'll do a follow-up video with the later part. So what I want to focus on today is P6, P7, M5 and D4. I'm going to leave the other sections which are about confidentiality for another video. So what we're going to focus on here are meeting the needs of individuals. We're going to focus on the roles and responsibilities of different groups for P7. We then need to assess the benefits of multidisciplinary and multi-agency teams, and then evaluate how useful these sort of collaborative working teams are generally, but also in context of our individuals. So that's what we're going to talk about through this session. So the first thing is, what is multi-agency working? So multi-agency working is this idea that multiple groups work alongside one another. They work together collaboratively to provide support for individuals, care users, to cover all their needs. And the idea being that this is quite good in a number of ways to ensure that support is provided, but also that there are no gaps within services. So the kind of pure definition of it is what we've got here is multi-agency working is about different services, agencies and teams of professionals and other practitioners working together to provide services that meet the needs of different individuals. And again, it depends on what the needs are, but often most individuals will have a multidisciplinary or a multi-agency team working with them. So the benefits of it, as I said before, service users may need to deal with numerous agencies. So having a multi-agency team will coordinate these different groups. It can need or lead to patients obviously having to repeat the story several times. So sometimes having a multi-agency team where they're working together can reduce this. But you might find that people may have services forced upon them if they don't have these teams. Obviously what they receive may not be efficient, may not be cost effective, and not all their needs are met by expertise. So this is why we need to have multi-agency work and what the benefit of it is. So multidisciplinary teams on the other side are a slightly different approach. So this is often one organisation with a range of different professionals working within it. So a multidisciplinary team, if you take the NHS or a hospital as an example, you would have consultants and nurses, dietitians, pharmacists. You'd have a multiple range of people from within that one organisation working alongside each other. Multi-agency teams is often, as I say, the name suggests, multiple agencies working alongside one another. So just to kind of put it in context, I've got this little diagram here that I've put together to try and explain the difference and also some of the general pros and cons of using them. So multi-agency working or multidisciplinary teams, they can sometimes be called interconnected working, which is the idea that you've got multiple agencies or multiple groups working together. And what this does is it puts the client at the center. So it's a client-centered plan, it meets individual needs, and it's really good because it's a whole patient approach. It's what we might call holistic, in that physical, emotional and mental well-being is being covered. And because you're providing all this support and you're giving the individual a degree of control, it increases empowerment of that individual. Now, multidisciplinary teams, I mentioned, is one organisation, one institution, one setting that provides lots of different agents or individuals who are part of a team, and they're providing care. So I sort of say a hospital, you'll have doctors, GPs, healthcare assistants, consultants, nurses. So lots of different specialists or individuals, each taking on a different element of that person's care. A multi-agency team is the slightly sort of similar approach, but it's lots of different agencies. So this would be the council, the family, the benefits system, community groups, social workers. You might lead to home adaptations. It could be employers, all working together, again taking on a specific element of care and providing that for the individual. And what is also worth noting is that a multidisciplinary team, such as the one we've got over here, can be part of the multi-agency team. So a multi-agency team could be made up of employers and the council, but you might also find an institution like the NHS working over here as well. So it doesn't just have to be obviously multi-agencies, lots of agencies. You can have some multidisciplinary teams within that. Some of the benefits of, or some of the sort of pros and cons of a multi-agency, multidisciplinary team is sometimes you can have funding issues. So who is going to pay for elements of a care, particularly with a multi-agency team? This is problematic. That say an individual needs a specialist chair because of a back injury and it's been recommended by a chiropractor. Who is going to pay for that piece of equipment? Is it the employer's responsibility, the healthcare system's responsibility? Is it the chiropractor's responsibility? So that can be sometimes a bit of an issue with multi-agency teams. Who is going to provide the funding? But as a strength, you get people working together, so you get better cooperation between services that can increase integration and effectiveness of the care that people receive. It can avoid repeated care or conflicts in care from having groups working together. And organisations and individuals can sometimes push care responsibilities onto other agencies or other organisations to avoid having to do it themselves. So that can sometimes be an issue with a team, that some groups may not take a responsibility and kind of pass on responsibilities to other agencies. Now, data is shared securely, so that's a good thing when it comes to confidentiality, but it may mean that some agencies of a multi-agency team, like the family, may not always be able to access information, or all information may not be shared fully between agencies. Now, issues can be resolved quickly if there is good communication to solve issues, and it does rely on all agencies working cooperatively. So this can be a downside, that if agencies aren't cooperating, if they aren't communicating, and there's obviously errors in note taking and obviously the human error factor, then this can undermine some of the work of agencies. And it does produce a full picture of the client with their needs, which are updated and shared, but only if the information is fully shared between all groups involved. So let's think about our case study characters. So one of the things you need to be doing as part of P6 and P7 is linking these agencies to your case study characters. And the main things to think about with your chosen two is, what are the different professionals working with them? Who is making up their team of care? How are they being treated by the agencies? What are the different agencies doing? How is this going to benefit your individuals, and what are the issues involved? So just as a quick kind of thought mind map here, you can think about the different professionals in each case. So with Patrick, for example, he's got charity organisations, GP, nutritionists, sexual health advisors. He is going and speaking to the Citizens Advice Bureau. So he's got multiple agencies working with him. Nusrat's the same, GP, specialist epilepsy nurses. She's got support workers, advocates, she's got family, she's got her teacher for the drama class. So she has multiple people working alongside her. And again, this is the thing to think about first of all, is who are the professionals that work with your characters, and particularly what need is being met? What are they doing? What are they providing for each? So just as another kind of overview of it, obviously the multi-agency teams, I've tried to list a few of the people thinking or working with each of the characters, and then with the last column here, what need is being met. So how are they being helped? What is it doing for them? What support is being provided to them? What I've also highlighted in yellow in a couple of cases, just to kind of demonstrate, is these would be multidisciplinary teams as part of their multi-agency team. So with Nusrat, with the advocate, teacher, the sexual health services, family, there's obviously, she also has a specialist nurse, the epilepsy nurse. She'll see her GP. The epilepsy nurse, the GP, would be part of the NHS, which would make them a multidisciplinary team. They're part of the same organisation. The other individuals obviously would make up a multi-agency team, with multidisciplinary teams being part of this. Now, again, these case studies may differ slightly from yours, depending where you're looking at this, because the ads have been slightly adapted, but again, the general idea you can use with your case studies. So what are the benefits of multi-agency and multidisciplinary working? So we kind of touched on those earlier, but the main thing is that obviously a partnership should mean that all professionals work together, they focus on the client. Professionals can use their specific skills to cover specific elements of care. They can take priority or focus on the element they can do the best. So overall, the care is provided to the best of the individual's needs and obviously best of the professional's ability. It should reduce and hopefully remove any gaps in care. So the greater range of support people working with the individual removes any gaps, and if care is planned effectively, then it means resources are not wasted or duplicated, and it means that money can be spent better and cover a range of issues. And then we've got the weaknesses, the potential problems of these services. So again, the problems that can come from multi-agency working or multidisciplinary working is that, that there can be professional jealousy, anonymity, say it properly. There will be poor communication, could be problematic. Service users could manipulate the situation, but moving between some of the professionals and saying that, highlighting that one group hasn't done a certain element of care or hasn't provided certain things. And again, they could use the situation to kind of compete and conflict the providers against one another. Funding issues and limited overall funding, responsibility problems of who would take overall responsibility for care. Also, we need to understand the roles of different professionals, and even little things like logistical problems, like where do they meet? If you've got multiple agencies, lots of different teams, it's a lot of people, where would you get them together to discuss the client? So this is multi-agency, and generally some general pros and cons that could be applied to both. Now, when we think about our individuals, again, when you've got multiple agencies and multidisciplinaries working with them, think about the different professionals and different problems they can create. When you're talking about general problems like funding issues, try and relate it specifically to your case study needs. So think about some of the issues they have, like a case like Maria, where she wants night sitters and community care assistants. They're not available, lack of funding issues. So you could talk about how that would have an impact on her multi-agency team. So again, when you're talking about some of these pros and cons, try and be specific in how they could apply. Use examples from the case study sheets just to demonstrate that you are aware of how they apply, what they are, and you're not just repeating general points. You can also use cases to demonstrate the points that you're making. I think this is really important to do as part of these case study projects. So, a really significant case is the case of Baby Peter. It's a long case. It was obviously sort of 2006 to 2007 that it occurred. But what I thought about here was that the significance of that case was there was lots of agencies working together who failed to communicate effectively and share information about their concerns, which contributed partly to his death. So what I flagged up here was kind of a bit of a timeline of events, and I just flagged up who would have been involved in each case. So I just focused on police, the NHS and social care, and you can see over the course of obviously the events in this very short period of time, there were police involvements in a number of occasions, social care, NHS on a number of occasions. And one of the things about this is that if these agencies had been working collaboratively and sharing information between one another, the list of concerns would be far greater than a single agency having some concerns but then not really following it up because there's a gap or a sort of period of time when nothing happens. So again, this is a case of failings of multi-agency teams, and they're not working collaboratively. So just to kind of wrap up where we are. So for P6, start with a general definition of multi-agency teams. Who is making up the multi-agency team? Who is working with your case study characters? Who provides the benefits, or what are the benefits of those agencies with your characters specifically? And again, try and explain how their different needs being met. So think about, as it says here, nobody can specialise in every area due to time and skill. So what is each agency doing? What are they bringing to the table? So in terms of case studies like Patrick, you can think about sexual health advisors, GP, the counselling services, local housing officers, and obviously different agencies that might provide physical, emotional and financial support in his context. Nusrat, GPs provide greater epilepsy support, the epilepsy nurse, speech therapists, obviously she's working with teachers for a drama class, and in the context it talks about things like she may want to have relationships, get a job, live independently. So you could even branch out and think about who would in the future provide support and become part of that multi-agency team. Brenda has her GP, health visitors, the sheltered accommodation manager, she has an asthma nurse. So again, multiple agencies, multiple individuals providing different elements of her support. Alice has a GP, AA, bereavement counsellor and a nutritionist. Again, range of different needs being met by each of these individuals. So think about who is doing and what they're doing. Also branch out. I know with Alice, she has an advocate. She's got the community centre manager supporting her. So again, you can extend it beyond obviously the list here. Martin would go to the GP for his skin referral. He might see a dermatologist. And he has other needs. So, reading is an issue for him, employment issues. So he might be referred out to agencies like maybe like job seekers and support. He might go to sort of educational providers to help with his reading abilities. So think about who could also provide a need or support. And then Maria, we've got sleep problems for her, social services for her mum. She's got interpreters, community care assistants, the trade union rep, head teachers. Again, lots of different people involved, all providing a different element of her care and support. Now for P7, again, highlight general definitions of multidisciplinary teams. So, nurses work with doctors, it's part of the NHS. What you also need to want to include is a general definition of some of the roles and responsibilities. So some of those different professionals, stick with, doctor, nurses, you might want to put healthcare assistants, occupational therapists. Think about some of the people who work with your characters and talk about their role. What is the role of their job? What responsibilities do those professionals hold? And how do they relate to your case study characters? M5, moving on to the benefits of this. Again, it's an extension of P6 and 7. You can do this at the same time as writing P6 and 7 or do it as a block afterwards. But ultimately, what's the benefit? Why is it good to have a multidisciplinary, multi-agency team? You can put quite generic points and benefits of these teams, but also try and be specific to your characters. How does it benefit the two people you've chosen? So how will it help them? How will it help them develop and meet their needs? And try and extend beyond that. And obviously, if they can speak to experts in their fields or no one person has to take responsibility, again, try and link that to your individuals. Try and give examples and demonstrate what you mean. And last but not least, the evaluation points. So again, it's a further extension of P6, P7 and 5. What are the strengths and weaknesses? Quite generic strengths and weaknesses could be fine here, but do try and link it to your case studies if applicable. Try and link to real world examples. As I mentioned Baby P earlier, it's a really good example of what's happening here. And again, this isn't just a bullet point list of pros and cons. Try and put this into some discussion, full sentences, and make it clear why it's helpful, why it's not helpful to do this. And at the end, come and reach to a kind of conclusion. Is it better or worse to have multi-agency, multidisciplinary teams? What are the alternatives to not having them? How is this going to improve the condition of a number of these individuals? And these will be the main things to think about as part of this project. So again, very, very roughly, P6, P7, M5 and D4 kind of cover there. Again, textbook has loads of information that will help with you writing this. And as always, thanks for watching and hope this helps.